pleasure to introduce our three presenters, each of whom brings their own unique perspective on the subject. Chantal Palmer is a registered nurse and patient educator who has been with the St. Paul's Hospital Dialysis Program in Saskatchewan for the last 10 years. Krista Nahn grew up on a farm in southwest Saskatchewan and today is a registered dietitian and certified diabetes educator with the Kidney Health Community Program at St. Paul's Hospital in Saskatoon. Krista's focus is on helping people live well with kidney disease every day. Dr. Dan Martinson is the Provincial Director for Pharmacy for BC Renal and a Fellow of the Canadian Society of Hospital Pharmacists. He chaired the Pharmacy and Formulary Committee with BC Renal since 2001 and has been involved in numerous projects and publications over the years. In 2013, he was the recipient of the Wilma Crockett Award for Outstanding Contributions in the Care of People with Chronic Kidney Disease. Dan's main research interest is improving patient outcomes for the same or a lower cost. I'll now give Chantal Palmer the floor. Welcome, Chantal.
Thank you for that introduction, and thank you all for logging on today and joining us. My name is Chantal, and my presentation is called Newly Diagnosed with Chronic Kidney Disease, Now What? Living with CKD. I'm just having trouble advancing my slide here. Sorry about that. Being diagnosed with kidney disease can bring on many different emotions. You may be feeling worried, sad, frustrated, and curious. I'm going to talk to you today about the stages of kidney disease and some of the common lab values important to people with kidney disease. Just a little note on why our kidneys are so important. Our kidneys act as filter that clean our blood, and our kidneys are made up of millions of tiny little filters called nephrons. Most of us are born with two kidneys, and they're located on either side of our spine. They are approximately the size of our clenched fist. The smaller the person, the smaller the kidneys. Your kidneys filter your blood to remove waste products, extra fluid from your body, from the foods that you eat, all the fluids that you drink, and the medications that you take. Our kidneys also make and release hormones that help control our blood pressure, make red blood cells, and help to keep our bones healthy. In North America, the most common cause of kidney disease can be related to diabetes and high blood pressure. Other causes can be kidney injury, heart disease, autoimmune disease, and some genetic or hereditary conditions. In some cases, the cause can be unknown. As we get older, our kidney function can also decline, and some ethnic groups are at increased risk of kidney disease. When diagnosed with kidney disease, your doctor will calculate your estimated glomerular filtration rate, or eGFR, which is the approximate percentage of kidney function that you have. This is calculated using your creatinine result, your age, and your gender. Your eGFR tells us how well your kidneys are working. The lower the eGFR, the less your kidneys are working. For example, an eGFR of 48 means you have approximately 48% of your remaining kidney function. There are 5 stages of kidney disease, with stage 1 being the mildest, progressing to stage 5, which is kidney failure or end-stage renal disease. You can be diagnosed with kidney disease at any of the stages. It is often diagnosed with a urine or a blood test. If you are diagnosed with kidney disease, the goal will be to identify the cause of your kidney disease, treat that cause, and attempt to stall or delay your kidney function from worsening. Stage 1, normal kidney function. Your eGFR is greater than 90%. In stage 1, there usually are no symptoms yet. Many people aren't even aware at this point that they even have or are developing kidney disease. If you have conditions such as diabetes or high blood pressure, or a family history of kidney disease, your family doctor might be screening you for kidney disease. Stage 2 or mild kidney disease. Your eGFR may be between 60 and 89% at this time. Often people will not have symptoms at this point either. The goal will be to stall or slow down worsening kidney function. Your doctor will monitor your lab tests, your blood pressure, diabetes if you have it, and your general health. You may be referred to a nephrologist at this stage. A nephrologist is a doctor that specializes in kidney health. Stage 3 or moderate kidney disease. In stage 3, your eGFR would now be between 30 and 59%. You may now be starting to show symptoms of kidney disease. These early symptoms can include increased tiredness or fatigue, poor appetite, and itching. Stage 3 is often now when your family doctor will refer you to a nephrologist or a CKD or chronic kidney disease program, where you will meet a team of health professionals, which may include the nephrologist, a nurse, a pharmacist, a dietitian, a social worker, a diabetes educator, and an exercise therapist. Your nephrologist and CKD team will continue to work with you to monitor your blood work and help to attempt to slow your function from declining further. Stage 4, this is more severe now. Your eGFR is usually between 15 to 29%. You now may be noticing your symptoms are worsening or that you are experiencing new symptoms. These symptoms can include increasing fatigue and tiredness, loss of appetite, nausea, unintentional weight loss, itchiness, shortness of breath, and swelling. You may or may not experience some or all of these symptoms. Sometimes loved ones actually notice these symptoms first, as they can come on very gradually. They may notice that you are sleeping more during the day, or that you are no longer cleaning your dinner plate. Food you used to love may no longer taste good to you. Your kidney doctor may ask you to have more frequent blood work done at this point. And your CKD team may now start to introduce treatment options with you. As your kidney function declines, you will need to know about what options you have for treatment. These options can include peritoneal dialysis, hemodialysis, transplant, or conservative management. Stage 5 kidney disease. This is now when your eGFR is less than 15%. This can also be called kidney failure or end-stage renal disease. Your symptoms will most likely start to become more severe at this stage. Treatment options will need to be discussed if they haven't been already. If you have chosen to start dialysis, you will need to get a dialysis access in place. If you've chosen to do peritoneal dialysis, you will need a PD catheter inserted. If you have chosen to do hemodialysis, you will need a fistula, a graft, or a hemocath. Your doctor may choose to now initiate dialysis. Transplant is also an option for some people. Your nephrologist will refer you to a transplant program if you are in fact a candidate. A transplant assessment can take several months or even up to a year to complete. There's also conservative management or supportive care. You may choose not to pursue dialysis or transplant, and your CKD team can provide you with supports to help make you comfortable and live your best quality of life. It is really important to discuss your goals of care with your loved ones. Progression through the stages. People often wonder how fast will their kidney function decline. Remember that you can be diagnosed at any of the stages, 1 through 5. Sometimes people aren't even aware of their kidney disease until they're diagnosed in the later stages, say 4 or stage 5. Progression from stage 1 to 5 can and will be different for everybody. For some people, it takes years, and others, it only takes months. This can depend on the cause of your kidney disease, your other medical issues or comorbidities, and your adherence to the recommended treatments. Your function may decline suddenly at times and then plateau for a bit before it declines again. It's really hard to predict how fast you will progress through the stages. Your CKD team can help guide you. I'm now going to switch gears and speak to you about some of the common lab values you may be learning about in your new diagnosis. Lab values can be confusing and overwhelming at times. Some of the targets we use in kidney disease are the same for the regular population, while others we change slightly. The middle column on my slide is the value for the general population, and the CKD goal is on the right. Creatinine. Creatinine is a waste product in your blood that comes from muscle activity and breakdown. Normal creatinine is 45 to 110 micromoles. Your creatinine level goes up as your kidney function goes down. Your creatinine level will be compared to your creatinine level and monitored with each blood work test. Your eGFR, as we mentioned before, tells us how much kidney function you have and how well your kidneys are working. The lower the eGFR, the less your kidneys are working. Your eGFR will be compared to your previous eGFR. The ACR, or urine albumin to creatinine ratio, is a urine test. Normal is less than 3 milligrams per millimole. This is the amount of protein in the urine. When protein leaks into the urine, this can mean you have kidney disease. The more protein in the urine, the more kidney damage you have. Hemoglobin is the next one. Hemoglobin is a part of the red blood cells that carries oxygen from your lungs to the rest of your body. Normal hemoglobin levels are greater than 115 grams per liter, and in people with kidney disease, the target is around 100 to 110 grams per liter. Your hemoglobin level can often go down as your kidney function worsens due to changes in some hormone production. If your hemoglobin level drops, you develop anemia, which then makes you feel tired and have little energy. Anemia is a common problem for people with chronic kidney disease. You may be prescribed medications to help boost your hemoglobin. Calcium is a mineral that is important for strong bones. Your kidneys are supposed to help regulate your blood calcium levels. Normal calcium is around 2.1 to 2.5 millimoles per liter. The same goal is the goal is the same for people with chronic kidney disease. Your calcium level may go down as your kidney function goes down. You may be prescribed medication to keep levels normal. The last one on the slide is the phosphorus. Phosphorus is a mineral that is found in foods such as dairy products and in many food additives. In people with kidney disease, the target is to have a phosphorus of less than 1.5 millimoles per liter. Your phosphate level may go up as your kidney function goes down. You may be asked to make some diet changes or to take some medication to help keep your levels acceptable. A high phosphorus level can lead to weak bones. PTH, or parathyroid hormone, is a hormone that helps balance our calcium and phosphate in our blood. Normal is less than 8 picomills per liter, and our CKD goal is less than 40. The PTH often goes up as the kidney function goes down. You may need to make diet changes or take medications to help keep your levels acceptable. Good PTH control helps to keep your bones healthy. Next on the list is potassium. Potassium is a mineral found in most foods, and it's the kidney's job to regulate the potassium levels in our blood. Potassium helps keep our heart and muscles working properly. Normal potassium is 3.5 to 5.1. A potassium level that is too high or too low may weaken your muscles and change your heartbeat. Whether you need to change the amount of high potassium foods in your diet depends on your stage of kidney disease. Your CKD dietitian can help you plan your diet to get the right amount of potassium. Sometimes medications are needed as well. Bicarbonate is a form of carbon dioxide that we all need in our blood. It helps keep our blood from becoming too acidic. Healthy kidneys help keep your bicarbonate levels in balance. The CKD goal is 20 to 25 millimoles per liter. You may be prescribed medications to help balance your bicarbonate. Another lab value that is commonly monitored is the iron saturation. In people with chronic kidney disease, we want your saturation to be above 20%. You need enough iron in your body to help build red blood cells, which will help increase your hemoglobin, which will then help with your anemia. You may be prescribed medication to keep your iron stores in range. The last two lab values I will discuss are going to deal with blood sugar and diabetes. Glucose is the sugar that's in your blood. Your blood glucose will be monitored, and you may be asked to check your blood sugars at home. Normal values are 3.6 to 10 millimoles per liter. If you have diabetes, you may be referred to a diabetic educator and be prescribed medications to help manage your blood sugars. A hemoglobin A1C shows an average of what your blood sugars have been over the past 3 months. The goal for an A1C is around 7%. Good blood sugar controls help to protect your kidneys. You may work with a diabetes educator to help manage your A1C. Figuring out all this new information can be overwhelming. You can discuss your lab values, new dietary requirements, and medication changes with your CKD team. This can include your nephrologist or kidney doctor, your nurse, your dietitian, your pharmacist, or your diabetes educator. There also are some good internet sites out there, but make sure they are legitimate, that these can help you make sense of some of these things. Well, that brings my portion of the presentation to a close. Thank you all for listening to me. And before I pass it off to the next presenter, Krista, we have a quick poll question for you to answer. So thanks, Chantel. I'll just move on to my section now. So as mentioned, my name is Krista, and I'm a dietitian and diabetes educator working in kidney health out of St. Paul's Hospital in Saskatoon. So I'm going to talk today about some steps you can take to slow progression of kidney disease. Firstly, if you smoke, reducing how much you smoke is a helpful way to slow progression of chronic kidney disease. Smoking narrows and hardens blood vessels, which decreases the blood flow to the kidney. Kidneys struggle when there isn't a good blood supply. So if you need support with quitting, there are different supports in place depending on where you live. The Smokers Helpline is a common resource for people trying to stop smoking. Your doctor and pharmacist may also be able to come up with a plan to help you quit. The second point I'll mention to help slow progression of kidney disease is with the food that you eat. So eating too much salt makes our body hold on to fluid, which increases blood pressure. Extra blood pressure from high blood pressure in the kidney can damage the delicate filtering units in our kidneys and lead to progression of kidney disease. So typically aiming for around 2,000 milligrams or less of sodium is a good guideline. So I'd like to launch my poll question for this section on sodium. So the question is, which foods have been found to contribute the most to our daily intake of sodium? So if you want to check what category you think, on here there's cheese, mixed dishes, processed meat, bakery products, snack foods, and then salt added at the table or in cooking. I might just give it another 15 seconds and then I'll end the poll. So I'll share the results. So this information is based on the sodium intake of Canadians in 2017 publication. And if you chose either bakery products or mixed dishes, you are correct. So each of these categories contribute about 20% of our daily intake of sodium, followed by processed meats, and then the others contribute smaller amounts. Bakery products can contribute a large amount of sodium to our diet without us realizing, as these foods don't typically taste salty, but we tend to eat larger amounts of them, and therefore the amount of salt in them adds up. So for example, a slice of bread can have about 200 milligrams of sodium, and a muffin that you might pick up from a takeout restaurant can have between 300 and 400 milligrams of sodium. So we can see how it might add up. Whole grain products are still healthy choices, but it's interesting to realize their potential contribution to the sodium in our diet. Processed foods, as we are aware, are higher in sodium as well, such as things like pizza. We commonly hear that people feel they're following a low sodium diet if they aren't adding salt to their food without realizing the contribution of sodium in any prepared foods just from the way that our food is processed. Another common myth we hear is that maybe sea salt or pink salt might be healthier choices, but when we look at the sodium content, which is what impacts our kidney health, the sodium content is very similar between these specialty salts and just regular table salt. So this means that they affect our blood pressure in a similar way, so one is not healthier than the other. Some tips to help decrease sodium are eating fresh food, rinsing canned vegetables and beans with water before you use them, diluting canned soup with more water and adding in vegetables and spices. If you're using a high sodium ingredient, so for example, tomato sauce in a soup, then try using lower sodium ingredients for the rest of the recipe. And using garlic, pepper, onions, and herbs to season your food instead of salt. Another option too is to use low sodium soy sauce and try only using a small amount. When you're reading nutrition facts tables for sodium, try looking for food choices that have less than 5% daily value, which you can find on the right-hand side of the nutrition facts table. So 5% or less would mean that it's low in sodium. Another option is to choose foods that are labeled as no added salt, as these foods would only contain naturally occurring sodium. So along with limiting added sodium, it is recommended to limit phosphate additives as well. So phosphate additives are added to processed food to make them last longer and to improve how they taste. Intake of phosphate additives has been associated with risks to the kidneys, and as kidney function declines, your body has trouble getting rid of extra phosphate, leading to a buildup of phosphate in your blood, which can have negative effects on your body. So phosphate additives are found in processed cheese slices, processed meat, such as bologna, ham, sausage, bacon, salami, and wieners. It's also in instant milk puddings, pancake mix, muffin mix, dark sodas such as cola, and hot chocolate mix. Look at labels to avoid ingredients that have the word phos in them. So common examples are sodium phosphate and calcium monophosphate. Naturally occurring sodium isn't as easily absorbed, therefore doesn't have as large of an impact on our kidneys as phosphate additives do. Though in later stages of kidney disease, some clients may have to avoid naturally occurring phosphate as well. Typically, foods that have phosphate additives are also high in sodium. So avoiding these processed foods helps to avoid both sodium and phosphate additives. And eating fresh foods is a great way to limit both sodium and phosphate additives to keep your kidneys healthy. The thing I'll briefly mention in regards to diet is to drink water instead of sugary or caffeinated beverages. Drinking water is the best choice to keep our kidneys working well. If you struggle with drinking water, try infusing it with fruit or cucumber to add some flavor. And lastly, in regards to what we eat, limiting excessive amounts of protein can help preserve kidney function. As a general guideline, a serving of meat should be about the size of a deck of cards at each of your meals. If you like to eat plant-based protein, such as lentils, beans, and chickpeas, these are also good choices. It's important to note that everybody who has kidney disease may have slightly different dietary recommendations based on their lab work and the stage of the kidney function. So Googling diet information may not be helpful, as you may end up avoiding foods that aren't necessary. Speak to a renal dietitian to find the best dietary guidelines for you to follow. The third tip to help preserve kidney function is with exercise. So the kidneys benefit from improved blood flow, which happens when the blood is pumping well throughout the body, which is a benefit of exercise. So guidelines generally recommend getting between 30 and 60 minutes of exercise, such as walking, jogging, or cycling, about 5 days per week. But start small and do exercise that you enjoy. When you exercise, there's a multitude of benefits, including helping to control your blood pressure and blood sugars. Diabetes and high blood pressure are the leading causes of kidney disease, so managing your blood sugars and blood pressure are some of the most effective ways to preserve your kidney function. For people with diabetes, exercise can help your body use the insulin better, which can lead to improved blood sugar control. For those of us with diabetes, you've likely seen the benefit of exercise on your blood sugars. Blood pressure can also be improved with exercise. Exercise can also help to reduce cholesterol, which helps keep the blood flowing well through your kidneys. Not only can exercise help with preserving kidney function, as just mentioned, but exercise can also help with your stress, mood, help you sleep better at night, and help with your mobility. Start exercise slowly and speak to your doctor or exercise professional in your area if you have any questions before starting any program. And lastly, if you're followed by a multidisciplinary kidney health clinic somewhere across the country, regular follow-up with your team can be helpful in slowing progression of kidney disease. Regular blood work and review of your medications, diet, diabetes control, and blood pressure control is helpful in managing progression of the disease. In the days of the pandemic, it may be difficult to get to appointments and to have your lab work completed. Depending on where you live, there may be either phone visits, video conferences, or telehealth conferences available with your nephrologists and healthcare team members. It's important to do our best not to put our health on hold while we live through this pandemic. If you're feeling down, stressed, or distressed, seek help to manage, as it can be overwhelming to be managing multiple health conditions along with the added stress of the pandemic and social isolation. So as a review, reducing tobacco use, eating fresh foods that are low in sodium and phosphate additives, exercising most days of the week, and having regular follow-up with healthcare professionals to ensure your blood sugars, blood pressure, and other health conditions are managed are important ways to slow progression of kidney disease. Medications also have a significant role to play in helping preserve kidney function, so that leads nicely into our next speaker. I'll turn things over to Dan, the pharmacist, to speak about medications and your kidneys.
Hi, everyone, and thanks to Chantel and Krista. Can I just get a confirmation that you can see my screen?
We can see
Sure.
it, Dan.
We can see
Thank
it.
you. Thank you.
I can see it.
So absolutely, this is a team effort to help you with your kidney disease. And the pharmacist is really here to help you manage your medications, but you'll see some of the messaging is really much the same. So if I could have the first poll question, please. So medications can slow kidney disease if you can read the questions and answer. I know as much about them as possible, take them as prescribed, know the circumstances when I shouldn't take them for a short period of time, combine medications with positive changes in lifestyle, discuss concerns and possible side effects with my doctor and pharmacist. If you can vote, please.
Dan, we're not able to submit, or at least I can't.
Okay, it looks like some people are able to, so it looks like it's trending in the direction that I thought it would. So we'll probably just end the polling, and I apologize if you're not able to submit. So for those of you who answered all of the above, that is correct. And certainly if you just rather discuss concerns of possible side effects with your doctor or pharmacist, that is a valid choice as well, as are the others, but they all will be effective. Okay. So, of course, as a disclosure, this is for your information. Your particular condition, discuss your health with your healthcare team. But there's a lot of evidence that backs up what I do present today. And really, I want to let you know that the kidneys, I consider them to be the canaries in the coal mine. The kidneys are a very sensitive couple of organs in our body. And they're sensitive to low oxygen, low blood pressure, high blood pressure, dehydration, obesity, certain drugs for sure, high blood sugar, reduced blood flow, and smoking. But fortunately, the kidneys can compensate for these stresses, if you will, by increasing oxygenation, raising or lowering the blood pressure, regulating blood sugar, increasing blood flow, compensating for dehydration. So they really are a marvelous couple of organs that we have inside us. Yes? But only to a point, and then problems begin to occur. And as was presented earlier, you know, all of these things can cause stress to the kidney and lead to kidney disease and kidney failure. And we can affect the top four, the bottom three, not so much. So really in managing your health, it's good blood pressure control, good blood sugar control, taking medications as prescribed, maintaining a current medication list, knowing what non-prescription medications are safe for you to take. So you have the freedom to choose, but you also have the responsibility to choose wisely. Making healthy food choices, smoking as little or not at all, getting exercise, following your blood work, and identifying what keeps your attitude positive. And in this pandemic year, I think we can all use some of that. So I want to touch on, can medication slow kidney decline? What are some common medications used to help the kidneys? How can I keep track of my medication? Should I take my medications when I'm sick? Are there medications that can harm the kidneys that I should avoid? And when non-prescription medications are safe. So here's a graph, and I apologize for that, but on the vertical axis, we have kidney function, whether it's, you can say it's percentage or the eGFR, if you're familiar with that. And in the red zone, that's when patients might start dialysis. So in this particular graph, you see the green line as if in one particular study, patients took placebo, or if they took the medicine or the active part of the study. And after an initial drop of the kidney function, the kidney decline slowed down. And what this means is patients in this patient could gain perhaps 8 years before they would require renal replacement therapy, which is obviously speaks to quality of life and is good for the person, but good for the system as well. And so when we think about medications for diabetes or blood pressure, this is slowing the decline of kidney function. So this is a very important concept. It's not all or nothing. The more we can do to help slow the kidney decline, then that's the best. So I'm going to touch on some self-management strategies. Obviously, I can't discuss all the medications that we use in kidney disease, but we'll just touch on a few themes. So ways to control your blood pressure. Take your blood pressure medications as prescribed, limit your salt intake as discussed, get your body moving as well. And you may not know this, but even moving that amount, getting exercise, you can reduce your systolic blood pressure by 5 to 10 points. As well as getting to a healthier weight can also reduce that. So that's can be the magnitude of the medications. So if you're on medications and you become active and reduce weight, you can actually perhaps reduce the dose of medication. And then learn how to manage your stress as well. So why so many blood pressure meds? Well, it's quite common for people to be on more than one. Each class of medications works in a different way, and using several classes at lower doses is better. If we increase the dose of any single one, or just use a single medication, we reach a plateau effect. So by using several different ones, we can achieve a greater blood pressure reduction with fewer side effects. So some examples might be what we call beta blockers as a class. This has the olol ending, but atenolol and metoprolol, calcium channel blockers. These end in dipene, typically, amlodipine, nifedipine, or ACE inhibitors, we call them, ramipril, lisinopril are a couple of examples. They're fairly common. We also have the ARBs, candesartan and losartan, diuretics or water pills, furosemide, hydrochlorothiazide, and then some other names, clonidine, methyldopa, and so forth. So there's lots of blood pressure medications out there, and we really try to fit which one is best for you. Most people do require 2 or more blood pressure medications. So if you're feeling you're on a lot of medications, that's one reason why we often can't achieve a good blood pressure target with just one medication. And with some classes, these ACEs, the ARBs, and I'll talk about these a bit later. Another class, there's an early drop in kidney function, but this is okay because on the long term, your kidney is protected by these medications. So for blood sugar management, controlling your blood sugar can help slow the damage being done to the filters of your kidneys and prevent further damage, not only to the kidneys, but the blood vessels in the heart and the rest of the body. Ideal ranges of blood sugar targets already mentioned. Take your diabetes medications as directed, follow the diet recommendations, of course. As was mentioned, a diabetes education center or nurse and dietitian of fantastic help. And get your body moving to help burn the sugar, aim for a healthy waistline. So to discuss some of the medications, there are many, and every year there seems to be more. Insulin, there are many types, and that is certainly a viable option. Many classes of oral medications. I'll talk about, just a few. Metformin is a very common one that's backed up both by evidence of benefit and has a favorable, what we call side effect profile. And that's good down to about 30% of kidney function. So that's a very common medication. The SGLT2 inhibitors, these end in agaliflozin, so canagliflozin, dapagliflozin, or empagliflozin, seem to have benefits not only for diabetes, but also for kidney function. Another group of medications, what we call the DPP4 inhibitors, these are linagliptin, saxagliptin, and sitagliptin, also seem to have benefit for kidney patients and a favorable side effect profile. But as I say, there are many other oral diabetes medications out there. And the one that's chosen for you is based on your particular condition and also what you can afford, or your plan that you're on can afford. Sulfonylureas such as glyburide or glycoside can also be used, and they're also common. And the choice really depends on the evidence of benefit and safety, and as I say, sometimes the affordability of these medications. Controlling cholesterol, you've heard probably statins. They are very common medications, and some generic names are atorvastatin, lovastatin, or rosuvastatin. So we just call them the statins. They lower the bad cholesterol, the LDL. And really, they're part of an overall heart and kidney disease prevention strategy. And blood pressure medications, diabetes medications, and cholesterol medications are not a substitute for good diet, active, healthy living. These help you as you're getting to those goals. Stopping smoking. Smoking, you think, would just affect your lungs, but actually it can contribute to kidney as well as other cancers. It does increase your blood pressure and damage your blood vessels. And the kidneys have many, many, many very fine blood vessels and are particularly sensitive to smoking. So if you're feeling it's the right time to quit, then talk with your doctor and your pharmacist. We do have strategies to help you. And a little bit about alcohol. Alcohol can actually increase your blood pressure, can increase your blood sugars, and it may impact the effectiveness of your medications. So alcohol in moderation may be acceptable, but again, we have to stress that you speak to your doctor about what the right amount for you is, but certainly less would be better. And then, as is mentioned, understand your blood work results. You can ask for an automatic copy of your labs in many provinces. Learn what the tests mean, what they're for, and get to know them a bit, and prepare to talk to your results when you go for a medical appointment. Now, in terms of your medications, keep a current list of all your medications, including your non-prescription medications, because you may not be able to speak for yourself, but the list can do that. When you go to healthcare appointments, even your dentist, take that list with you, and if you go to the hospital, very important. And as important as the list is, know why you're taking the medication, how you take it. And if you're not sure if a medication that you're thinking about or that you've been prescribed is kidney friendly, then just certainly ask your pharmacist. Here's an example of a medication list. And I put a red circle around the notes, the reason for taking. I think it's really important that we all understand what we're putting into our body, why we're taking it, what it's supposed to help with, and we can track to see if it is helping. Medication sick day rules. So you have more than minor vomiting or diarrhea. If it goes on for a while, vomiting, diarrhea, fever, sweats, and or shaking, maybe these are signs of a flu or food poisoning. That's a sign you're getting dehydrated. There are some medications that you should probably hold off on taking, and you stop taking the following medications and really only restart them when you're feeling well, 24 to 48 hours of eating and drinking normally. If the vomiting, diarrhea, and so forth persist, certainly get in touch with a healthcare provider or go to the hospital. So the ACE inhibitors, these are the pril drugs, ramipril, lisinopril, others ending in pril. the ARBs, these are the losartan, candesartan, or irbesartan. The diuretics, furosemide, hydrochlorothiazide, or chlorthalidone. Metformin should be held if you're feeling under the weather like that. What we call the NSAIDs, these you can buy without a prescription sometimes. Ibuprofen and naproxen are examples. And then the SGLT2 inhibitors, the canagliflozin, dapagliflozin, or empagliflozin. And then the sulfonylureas. So these are a group of medications that probably you should just take a little drug holiday from if you're that under the weather. And we do have a little hyperlink there, which I'll also mention at the end. So about your pharmacist in the community, really the pharmacist is on your team to help you optimize your health. Certainly ask questions. And the nice thing about certainly community pharmacists is that they're available without an appointment. They're perhaps the most available healthcare professional to you. And just pick up the telephone or drop by your local pharmacy. And I would encourage you to go to one pharmacy and get to know them, and they will get to know you. So about medication changes, as the years go by and your kidney function changes, so your medication needs will as well. And what you're currently taking may not necessarily meet the needs of what you need to take in the future. So those medications will change. And really, our goal is to give you what you need, when you need it, and in the right dose. And so when it comes to balancing the medications, we are thinking that we want to maximize the effectiveness of the medication. So whether we tell you to take it with or without food as an example, or a certain time of day, and that we want you to experience the fewest side effects, and talk to your doctor or pharmacist about flexibility around dosing and timing. If you take something on an empty stomach and you get nauseated from it, maybe it's better to let you take it with a little bit of food rather than have you not take it. And with regards to reducing the side effects, obviously the medications we give you have benefits, but they can cause side effects. And really our job is to minimize the side effects and maximize the benefits. And when a new medication is prescribed, talk to your physician, pharmacist about what side effects are possible, and a plan to minimize those side effects. And if it's particularly bothersome, we have many medications that are disposal to help you. And we may ask you to take those medications differently, or we may actually switch to a different medication for you. So don't suffer in silence. Be aware when you start a new medication or a dose has changed, be aware of your body and what's going on with that medication. Sometimes side effects will diminish over the first couple of weeks of taking it, but if it really persists and is affecting your quality of life, talk to us about that. Now, organizing your medications. Medication lists help. Relatives certainly help. Whether it's a spouse or one of our children to remind us to take medications. Tablet organizers, as pictured here, is a great way so you can be in control. And so each week you might sit down and just fill your little dosette of medications. And what's really nice about this approach is if you open up Tuesday morning slot and the medication is there, then take it. And then later this afternoon, when you think, did I take my medications? You open up the Tuesday morning slot, the medications are gone. So that's a lot better than opening a vial in which it doesn't tell you that you took your medications or not. Likewise, blister packs. This is something that a community pharmacist will prepare for you, and it's like a dosette, but already pre-packaged. That's another good way to help you organize the medications. And so really it's about what works for you. Even having a calendar on the wall that you cross off that you've taken your medications helps. Now, coming up later today, there's a talk on complementary and alternative medications, or medicines rather. I encourage you to attend that. Some herbal medications should be avoided. Some are safe with varying levels of effectiveness. And there's a website, herbalckd.com, that might be referred to. And you should probably avoid high doses of vitamin A and vitamin C, so over 500 milligrams of vitamin C a day. can actually lead in kidney disease to cause vitamin C kidney stones, which is not pleasant. So pain and anti-inflammatory medications, if you're taking low dose aspirin, then Tylenol is okay. Otherwise, ibuprofen, Advil, Motrin should not be used. And you should be aware cold and flu preparations containing decongestants and so forth should be avoided. This is just an example. This will be referred to in the slides.
Sorry, Dan, it's Lydia here. Just letting you know that we're going to run out of time shortly, so I'll just get
okay. Thank you.
A little bit. Thank you.
Sure. So this is just a chart. I'll just blast through this, but it really goes over common ailments that you can choose to take certain medications that are wise, good to take, don't take, and why don't take them. bcrenal.ca, we have all these resources available to you. And that's my presentation. Thank you, and hope you have a good number of sessions coming up in the next this afternoon and the next few days. Thank you.
Look, thank you so very much, Chantel, Krista, and Dan. I think that was really valuable information, and I could see that the chat room was flying to the side there, so that was great. The audience participation was fantastic. We do have a number of questions from the audience, but we also have some questions that were pre-submitted. So I'm going to start off with one of those, just because the people who went to the effort of putting them in, I'm sure they would have some great questions to ask as well. So some people have said that someone said that they've just started hemodialysis about 6 weeks ago, and they're having severe headaches during the treatments. They've tried several things to find out what's going on with the headaches. They've changed dialyzers and fluids and speeds. Is it normal for your body to adjust when you're first starting out on dialysis?
I could speak a bit to this, but yes, it is. People do often find it is a big adjustment period, getting used to dialysis, getting used to how their body responds to it. The best thing to do is, ask to speak to your nephrologist at your treatments. They might have to adjust some of the how much fluid they are taking off. And maybe some of your medications as well, if you are feeling quite worn out in between your treatments. But it is definitely a shock to the system to start, and people will find they're not feeling the greatest. But then after their body becomes a bit more used to it, hopefully some of those symptoms will be more manageable.
Okay, thank you very much, Chantel. I've also had a question, and this one is probably for you, Dan, about when is the best time to take your blood pressure medications? Is night the best time?
Yeah, excellent point or question. There's actually some recent studies on this, and it seems that a number of medications are just once daily medications. So if you're on a once daily medication, morning, in fact, is the best time to take your medication. And for those of you on dialysis, ask your doctor, depends on what time you're going for dialysis. They may want to coordinate that time that you take your medication with dialysis. So take their advice in your specific, but if you're not on dialysis, generally morning is the best time. And if you're on a twice daily medication, evenly spaced.
That's great, thank you. And Krista, I've got a question for you as well. And it's just a comment about plant-based protein, and are people able to take plant-based protein when they're on part of a renal diet?
Yes, so plant-based protein can be higher in phosphorus and sometimes potassium. So it kind of depends on what your lab work is looking like. So there is no general kidney disease diet. It really depends on specifically your stage in kidney disease and your lab work. So I would suggest talking to a renal dietitian if you can to get specific guideline on that. But lots of times it can be included.
Yeah, that's really good information. I think speaking to your renal dietitian is a great way to start. And for a matter of fact, just speaking to all your healthcare professionals, they're a team and you're part of that team. So working together to get the best treatment for you is the way to go. Now, I'm just going to ask a question about a very hot topic. And, at the moment, all the rage and all the talk is about the COVID-19 vaccines. And I just wanted to see if maybe Dan or if Chantel, you had any comments to make about the vaccines and their use in dialysis patients at the moment.
I know here in Saskatchewan, our nephrologists are recommending that if patients meet the requirements that the general population would be to receive the vaccine, they should take it. We have had a handful of our patients here in Saskatchewan start to receive it. Out in our reserves, they are starting to immunize people, and we've had a few calls about that. So as long as they're healthy and can take the vaccine, they don't have any allergies or contraindications to the vaccine itself, we are recommending our patients get the vaccine when offered and get whichever vaccine is offered to you at this point.
Yeah, I would just back that up saying, if you're wondering which vaccine is best for you, it's the one that's offered to you. And be sure if it's a 2-dose series, you get the second dose. Patients on dialysis may not have as strong immune systems as those not on dialysis. So it's important that you do follow up and get that second dose. It'll vary each province, which, the timing of when you get the vaccine offered to you, but it is safe to take.
Okay, thank you very much. Also had just a late breaking question come through here, which is quite interesting. And I think, Krista, you might be best posed to answer this question. It's about taking licorice and also licorice tree, and will that raise your blood pressure, and how does that work?
I don't actually know the answer to this. Maybe Dan can help me out.
Okay, sure.
Yeah.
Sorry to put you on the spot like that.
No.
Artificial licorice is no problem. Real licorice, if you do have higher blood pressure, it's probably a good idea to avoid it. It can interact with some medications. But if you can withstand the fake licorice, it's probably cheaper anyway. But I would avoid the real licorice.
Okay, thank you. And Chantel, a question for you. Just about a few comments were coming through as you were speaking about being diagnosed with CKD in the early stages. And I was just wondering if you could talk a little bit just generally about if someone goes to their doctor, what steps are normally taken to diagnose CKD.
For sure. A lot is really up to your family doctor. They're usually the ones that do the initial testing. If you are living with, an autoimmune disease, or you have known diabetes and high blood pressure, your family doctor should be screening you every year for kidney disease. And then if, they do notice that you do have kidney disease, they should look at, treating what condition you have that's causing the kidney disease. Here in Saskatchewan, usually patients are then referred to an actual nephrologist kind of around end of stage 2, beginning of stage 3. And then that's where you meet the whole team, the nurses, the pharmacists, the dietitians, the social worker, all those professionals that work with you and help kind of guide you through your diagnosis. So if I, or say a loved one, develop diabetes, then I would automatically be asking my family doctor to make sure they're then screening me for diabetes. Screening me for kidney disease and keeping track of that as well. So, sometimes people are diagnosed by surprise. They maybe end up in the emergency room with a completely unrelated condition, and the doctor does blood work, and then they're told you have kidney disease, and they might not have ever known it. So that's the thing about kidney disease, is it can sneak up on a person. You can have it and not know it for many years until, you actually have the blood work done to show it. So, you can ask your next physical or visit with your family doctor. It's a simple blood test they can do to screen for it. And then, you can ask for a referral if needed.
Okay, that's really great. Thank you very much. And we're just keeping an eye on the time, and this will probably be the last question, but we've had a few comments in the question box about how people can speak to other patients who have had kidney disease themselves and how they can get in touch. And the team has been busy just talking a little bit about Kidney Connect and peer support services. So please do visit our website, kidney.ca. But I'd also like to throw it out to our 3 presenters of how they've seen patients get sort of more of the less informal supports when they're maybe first diagnosed or wanting to get further information just from their experience.
I'll go first. The kidney disease affects 1 in 10 people, believe it or not. You can lose 80% of your function and not know it. So there's a lot of people out there going through similar things, and get in touch with your kidney care clinic, pre-dialysis clinic, and they're often peer support groups either in your area or in your province. So certainly follow that up.
I would agree with what Dan said as well too. You know, they're also, I mean, before COVID, we also used to have, you know, patient family advisory council here at St. Paul's. I think we're still trying to do it. It's just obviously more difficult with the social distancing and whatnot too. But, you know, those are some groups that you can join in your area if they're available too. And you can have your voice heard or your family member's voice heard and help, you know, advise us as healthcare providers, guide your treatment as well too.
Yeah, thank you very much. That was some great answers. And thanks you so much, Chantel, Krista and Dan, for being here today. It's been a very enlightening discussion, Move. Thank you very, very much. For any further information, please reach out to your Regional Kidney Foundation branch through our website at kidney.ca or email us at kidneyprograms@kidney.ca or programs@then.ca. The Kidney Foundation is committed to linking patients and families with the information and educational resources that they need, and we invite you to connect with us to speak further through this information. Just a reminder that all the information and the recordings of these sessions will be posted on our site following the event. So thank you very much, Dan, Chantel and Krista, for appearing here today.